Hi everyone, this is WestsideHill ABA TV. We have profound experience helping families and children with developmental needs. Today, we're going to talk about something incredibly important: early signs of autism in young children that parents and caregivers should never ignore. Early intervention truly makes a difference, so let's get right into it. First off, what is ASD? Autism Spectrum Disorder, or ASD, is a neurodevelopmental condition that affects how a person communicates, interacts socially, and processes information. It's a spectrum, meaning there's a huge range of symptoms, severity, and associated challenges. When does it show up? ASD typically shows up in early childhood, often before age 3. The signs can vary a lot, but there are some red flags that every parent should watch out for. Here are 7 signs that you shouldn't ignore. Number 1, no eye contact by 6 months. Babies naturally seek connection. So if your child rarely makes eye contact, that could be a concern. It's true that some kids are naturally shy, but if your child never looks at you or the people around them, that's something to note. Number 2, lack of social smiles or joyful expressions. By around 6 months, babies should smile socially in response to seeing familiar faces, especially parents or caregivers. If they don't seem to recognize you or don't get excited when you come home, it's worth noting. Likewise, if they don't respond to your smile, it's worth noting. Number 3, delayed or no babbling by 12 months. Babbling is the foundation for language. It's when babies practice the sounds they hear you making. So if your child isn't doing it by 12 months, that's a red flag. Some kids may start babbling later, but if you haven't heard any consonant sounds by 12 months, it's time to take action. Number 4, limited gestures. By 12-14 months, kids typically start pointing or waving. These gestures are powerful because children use them to share interest or ask for something they want. If it's not there, we take a closer look. Other important gestures include hand and mouth coordination, like clapping or bringing objects to their mouths. Number 5, lack of response to name by 12 months. Many parents think their child has hearing issues, but often it's that they're not attending socially. This means they aren't listening to you or tuning you out when you're talking to them. They may seem distracted or unresponsive even in quiet environments. Number 6, repetitive movements or behaviors. Hand flapping, spinning, or lining up their toys can be typical behaviors, but if it's frequent and rigid, keep an eye on it. Repetitive behaviors are often associated with sensory sensitivities. For example, spinning may soothe them if they have a vestibular or movement sensitivity. Lining up toys could be a result of a need for visual organization or a desire for predictability. Number 7, regression in skills. If your child used to talk or play but suddenly stops, that's a critical warning sign. It means they may have regressed and lost some of their skills. This could happen for various reasons, including hearing loss, a change in environment, stress, or a need for more support. So what should you do if you've noticed one or more of these signs? First, don't panic. It's not uncommon for children to display one or more of these behaviors without having ASD. However, it's crucial to act promptly. Don't wait until your child is older. The earlier you seek help, the sooner your child can receive the support they need. You can start by speaking with your pediatrician and requesting a developmental screening. You can also contact a licensed behavior analyst or early intervention specialist. They can conduct an in-depth assessment and provide an official diagnosis if needed. Early intervention is key. Research consistently shows that early ABA-based intervention leads to major gains in communication, social, and daily living skills for children with ASD. Remember, every child develops at their own pace. As parents and professionals, our job is to notice the differences that might matter. If you have concerns, trust your instincts and seek support. Early help is the best help. Thanks for watching. If you found this video helpful, please like, share, and subscribe for more insights on child development and behavior strategies. From all of us at WestsideHill ABA TV, remember to take care and see you in the next one.